And we are recording.
Great. So welcome everybody to the telehealth in-service for physical therapy. This is one of many tools we have in our toolbox that we can now add to our repertoire. Hopefully the information we present is useful for you all. We have a question and answer session at the end, but if any time you want to ask a question, please put it on chat and we'll try and get to those at the end of the presentation. Having said that, welcome again and let's enjoy this.
Okay, so we're going to go ahead and get started. Again, like Rudy mentioned, if you have any questions, put them in the chat and we'll go answering them down the line as we get to them. And we're going to go ahead and start this with Lydia. She's going to go over the terminology.
In regards to the terminology, and knowing the difference, so there's different terms. One of them is telemedicine, and telemedicine, that's to remotely diagnose, monitor, or treat a patient, and this is more so for physicians, so it doesn't really apply to us. The common terms that you're going to hear with us in the physical therapy will be the telehealth or telerehabilitation or e-rehabilitation. And what this is this will help the patients manage their own illness through our improved self-care, and this will be over telecommunication networks and the internet.
Okay, so then Rudy's going to go over the Texas PT/OT Board rules and regulations.
Okay, so according to Texas PT Rules 322.5, which is telehealth and addresses the provision of physical therapy services, this is the following points that they put on there. And you can read it on your own if you like, but I'm going to go through those points because it's important. Telehealth is used in the rules of the Texas Board of Physical Therapy Examiners, is the use of communications or information technology to provide physical therapy services to a patient who is physically located at a site in Texas other than the site where the physical therapist or physical therapist assistant is located, whether or not in Texas. B, physical therapy telehealth services must be provided by a PT or PTA. C, the provision of physical therapy services via telehealth requires synchronous, which is live video, audio visual, or audio interaction between the PT, PTA, and the patient, which may be accompanied using asynchronous store and forward technology, for instance, a home exercise program. D, standard of care. Number one, treatment by PT/PTA is subject to the same standard of care that would apply to the provision of the same physical therapy service in an in-person setting.
Okay. Thank you for that, Rudy.
Number two, the PT is responsible for determining whether an evaluation or the intervention may be conducted via telehealth or must be conducted in an in-person setting. Now, having said that, EPPTS' stance is that evaluations will only be performed in the office. Any follow-up visits to include a re-evaluation can be performed via telehealth. So next point under C, informed consent. A PT or PTA that provides telehealth services must obtain and maintain the informed consent of the patient or of another individual authorized to make healthcare treatment decisions for the patient prior to the provision of that telehealth service. Our stance in EPPTS is the following. All efforts need to be made to obtain an Adobe sign. Monday will be talking about that in a little bit. And it's an Adobe sign telehealth consent form. In the event it has not been obtained prior to the appointment, a verbal consent is acceptable if you document the following. Number one, that you're receiving a verbal consent for the patient name, and two, date the verbal consent is given. If the consent is received by a responsible party, it must include name and relationship to the patient in the documentation. We document this in the patient status / reason for referral tab. The written consent must be obtained prior to the next telehealth visit, even if you obtain a verbal one.
Okay.
Next point, F, confidentiality. PT/PTA who provides telehealth services must ensure confidentiality of the patient's medical information and is maintained during and following the provision of telehealth services, including compliance with HIPAA regulations and other federal and state laws. G, failure of the PT and PTA or PTA to comply with this section shall constitute detrimental practice, something we don't want to hear, and could subject the licensee to disciplinary action by the board. Next point, H. Telehealth is a mode for providing one-on-one physical therapy services to a patient / client and is not a means for supervision of physical therapy techs. They put aides there. A technician can assist during the telehealth visit, but must not leave the technician alone with the patient. Okay. Value of telehealth. That's Lydia.
Yeah, Lydia's going to go over the value of telehealth and the survey results.
Okay, so for the value of the telehealth, there were 3 main bullets according to J.D. Powers from 2019. That customer satisfaction with the telehealth services is high. So they were showing that the customer satisfaction score for the telehealth services is 851, which is 46% of their telehealth users. They also show the value of it is by positive word of mouth is a key to it increasing the adoption of it. With their study, there were nearly 2/3 or 65% of the telehealth users that used the service because they had received a positive recommendation from others. And then the third one was the telehealth works for most consumers using technology. And with them, there were more than 3/4 or 84% of their users were able to completely resolve their medical concern during their visit. So with that, we decided to do a survey at the clinics. It was for a 1-week period at the 3 clinics. And we wanted to ask the 3 main questions to them. We wanted to know, were they willing to participate if we offered it? Did they have access to electronics? And if they thought that the telehealth would be valuable. And among the 3 clinics overall, we did find at least a 50% on all of them. 52% was that they were willing to participate. 82% of them would have the electronics that they would need for it. And there were 50% that did think that it would be valuable to do the telehealth. Next is the reimbursement for the telehealth. And as far as reimbursing, it's going to be carrier specific based off the individual patient's plan. Right now, it looks like most of them may be covering it, but as the patients want to come in for that, we would need to verify their specific plan as each one may be different. In regards to Medicare and our MAP patients, although CMS does cover the telehealth, within our practice, we're not able to see those patients for telehealth because we are an OR facility and due to us being contracted through Medicare Part A. So for those patients, we wouldn't be able to do it.
Okay, and I am going to go over the technical component, or rather how we're about to do the telehealth visits for our PTs and our PTAs. So there is going to be a method of scheduling, which is we're going to be used as the bookings. The bookings, we went ahead and attached the bookings to the email, and there's a training guide that's going to be included on that. The PCs that are located in the clinics, we have assigned one room specifically, but you're by no means held to that room. At the East facility, we chose room 3. At the Horizon facility is room 8, and at West it's room 7. If the rooms are not available or occupied, laptops can be used. PTs are assigned laptops, so you do have access to that. And PTAs can use the tablets that the technicians use. There's no shortage of devices all across the clinics that we can use. Any device that has a webcam, you can log into your Teams account and do your telehealth visits via that mode. As far as the EPPTS procedures, we need you to refer to the attached documents, and we are going to go over this, all of us together. Let me get the proper screen.
Okay, so as far as the telehealth fees, unlike with the e-visit, there were specific amounts or reimbursement that they were going to pay. With telehealth, because it is the same codes that we would bill in the clinic, those fees are going to stay the same. So your evaluation's the 125, your re-evals your 75, and then your 97530, your 97110, 97112, and 97116 will be the $50 per unit. For our cash basis patients, the ones that will be private pay, we can still follow the private pay fee, which is the 125 for the evaluation, and then your $75 each visit thereafter. And we would use the same codes for billing those. For any of our patients that are covered under their insurance, we're going to use the same CPT codes, and we bill according to our contract with the insurance. And then for any patients that do have co-pays, deductibles, and our co-insurance, we do need to take this payment via credit card over the phone prior to their scheduled telehealth visit.
Next page.
The next one is the front office. This is in regard to the front office. So for the procedure for Optimus PT, when scheduling the appointment, there is a category. The duration will be the 30 minutes. For the category, it'll be selected as telehealth. Your visit type, selecting from the drop-down, you have your different options. It does give the telehealth initial visit, but at this point, we're not going to be using that one. But you can use the telehealth follow-up, the telehealth progress report, the telehealth re-eval, or a telehealth discharge if you're going to be discharging the patient within that visit. Once you're done, you'll click submit. And then on the next picture, it'll show you how it'll come out on your schedule. It'll be in like a fuchsia color, and that's how you know that one will be your telehealth. Next will be the procedure for bookings, and that'll be Armando.
Okay, so in addition to the instructions that Lydia gave you for adding a patient to the Optimus PT schedule, we will also be needing to add the schedule to the bookings program. The bookings program is the program that Confluent recommends that we use because it's going to allow the ease of the interaction between the PT/PTA and the patient. This will send a link to the professional and the patient of the scheduled telehealth visits. So your steps to adding a patient to the bookings program. You're going to open the bookings tab that's located at the bottom left of the menu in your Teams program. I have gone by now to every PC that has a bookings available and added that on there. On the next step, you're going to click on new bookings. Once you do that, you're going to select the type of visit that this is going to be. From Medicare e-visit, telehealth, or follow-up visit. Okay, I'm sorry. The next is you'll be adding the patient name, the email, and telephone number, self-preferably. You're going to verify the date, time, and length of appointment, and then you're going to verify that the correct clinician has been chosen. The fifth step on this is you can leave an internal note for the PT/PTA, such as the patient has an MD appointment next week or the like, and then you're going to click on the email reminder. On the internal message, it's only viewable by EPPTS, so this is a good way to communicate with your therapist. Number 6, you're going to add a message to the patient, such as make sure you have your HEP ready, make sure you're wearing comfortable clothes, etc., and then click on done. Once you have done that and hit the done button, the patient will be added into the booking programs, and it will appear below on the therapist team calendar. So it'll actually appear on their Outlook calendar and on the Teams program. And then in addition to that, the patient will be added to the booking schedule, and an email will be sent to the patient and the therapist. A reminder notification will also be sent the day before, and 30 minutes prior to the actual team's appointment. And we included a small picture that says you have a booking from test patient. It's a telehealth follow-up visit. We use the example of Isaac, and it gives you the date and the example.
Notifications to case management will remain the same, except the email will now need to include telehealth. So that way those telehealth specific benefits can be verified for the patient. If the patient plan does not cover telehealth, then that's when you can offer them the private pay cash basis. For the payment source within the system, the account will be set up under cash if the patient does not have, if it's not covered under the insurance. And then if it is covered, then the insurance will be what their actual plan is. In regards to additional forms, the only other additional form that we'll need to include in the patient's packet, if we know ahead of time that the patient will be coming for the evaluation and then want to just do the telehealth, is the telehealth consent form. This form is already has been translated to Spanish, so it's English and Spanish. It's located on public shared East-West HD forms, case management forms, telehealth consent, and then English and Spanish. For the patients, like I said, that we already know ahead of time that they're gonna want to do the telehealth, make sure you get that consent form on that day of the evaluation. For any other patients that are currently in their treatment and that at what point they decide that they want to do the telehealth, we do have the Adobe sign that we're able to do, and this consent will be sent to the patient once they're scheduled for that telehealth visit by case management and IS, and then we'll ensure that we get that form back from the patient. Some additional information is a patient can be scheduled for blended services. And what this means basically is that the patient can be seen in the clinic today and then decide that they want to do the telehealth visit on Monday. And then let's say Friday again, they decide that they want to come into the clinic. So they are able to go back and forth. Unlike with the e-visit, they weren't able to do that. You had to wait that time frame. With this telehealth, they're able to do both. The only thing is that the therapist or the PT or the PTA must document what's the reasoning that the patient wants to do that. What's the reasoning for us doing the blended service? Three.
Okay.
Okay, and now we are going to have Rudy's portion, which is the physical therapist and physical therapist assistants, and the procedure that you guys will be doing for this.
Mando, are you able to put that document up? I know they have it in front of them, but if they have it in front of them, that's okay.
No, absolutely. Just give me one teeny tiny second and I can grab that right and put it on there for us.
I'll be talking about the procedure, the actual procedure for performing the evaluation or the treatments under telehealth. Of course, we've decided for EPPTS stands not to do the evaluations under telehealth, but I want to provide you with that information in case we go towards that.
And
while Mando's putting it up.
give me a second.
Mm-hmm.
Coming up right now. And I'm just scrolling to your portion and then I'll share it. Okay.
Yeah. I got it.
That's okay, Mando. I'll start.
Okay. It'll
So,
pop up as we're going along.
really, with telehealth, it has been done in several other states. In Texas, we're just starting to, but I know that David Crowder and his group, outpatient or Texas physical therapy specialists, with 30 clinics throughout Texas and Oklahoma, have been doing this, and we've had several conversations. Really, for telehealth, we have to change our mindset, okay? The mindset being of we need to overcome a fear if we don't feel comfortable with technology. I know that's me for sure, but we need to overcome fear. Two, we need to own the service. We need to know that telehealth is a service that we can provide, and we can add to our patient repertoire in case they cancel or can't come in because of transportation or sickness. Then we can let them know that, hey, we have telehealth available. So we need to own our service, and then we have to be ready to listen, because a patient is going to tell us how to direct our treatment via telehealth. For instance, it's never going to fully take the place of traditional therapy, but it is another tool that you can use for delivery of services. The first step to getting your patient better is providing access to care. And that could be, like we said in our cards, that compliance has provided for us in one of three ways, and that is in person, the telehealth visit, or a phone call. So the second step is the buy-in for both the PT and the patient. If you don't have buy-in, that telehealth visit is not going to go well. So some of the questions that came up, and I want to cover those first, is, do I need to be certified in telehealth? No, absolutely not. Does it help? And what if I'm a manual therapist? Well, we're not going to bill for manual. If you can come up with a way of doing manual therapy through telehealth, please let me know. But obviously we can't do that. So, but the education of manual therapy certainly is a help, because it'll lead us towards the appropriate exercises that we need to teach the patient. So like Mackenzie and Maitland and Mulligan can use all those type of techniques in order to come up with exercises that are better suited for that particular diagnosis. And that's not all inclusive, of course. They also say that if your OCS, GCS, or NCS, which is the board certifications, that this also helps towards the buying in of telehealth for your patients. However, a telehealth visit does not preclude you from being a great telehealth PT. Like anything else, you will get out what you put into your profession. So, the most certifications we can get, the better for us. And that is something that Chole has really concentrated on over the last few years in telling us to maybe we should go in that direction, and I agree. With Confluent, we now have that ability through EIM, so we'll be talking about that another date. 2, tips for the patient, and that is so that we can provide the patient with telehealth, and that's using our email, or even better, having the front desk let them know about that, what they're supposed to be using during their telehealth visit. One is, you need to wear comfortable exercise clothing. 2, you need to test your computer beforehand. That's for the patient, letting them know, test your computer before we schedule that visit for lighting, sound, and any background noise you might have. At best, face a soft light towards you. That will provide a better professional type of a picture. Number 3, turn off all streaming services like Netflix, Amazon Prime, Xbox Live, YouTube, etc., so that it doesn't interfere with your visit. Use headphones if possible. These will cut down on feedback. Some services like Google Meet use a surprisingly accurate closed caption system. And if they have that, they can use that absolutely. Number 3 is tips for the PTs before starting your visit. Make sure that you have your support team secure your patient online. In other words, have the front office make sure that the patient is online and ready to go prior to you coming to the screen and starting your telehealth visit. If you're recording, get audio and video consent of the patient. Certainly not a mandated thing, but I think recording is important, because you can always go back and see what you've done or not done, and then take it from there for the following visit. Number 3, state the following, and this is all should be written under the reason for referral. Number 1, the physical location of the patient. Patient is at home, in the bedroom, in the living room, etc., etc. The physical location of the PT. This physical therapist is presently in room number 7 at the Westside Clinic. The names of all persons participating in the telehealth visit and their service role. Along with me as a PT indicating and instructing you on your telehealth visit, I also have with me Rosa Hallman, who is a PT tech and will be participating and assisting me in your telehealth visit and so forth. D, for safety, find out if anyone else is at home. Do they have a child? Do they have an elderly patient they have to take care of? Anybody else in the home that they might have to be interrupted for? For balance assessments and exercises, another person may be able to provide support for the patient. So if you're going to teach a balance exercise, before your telehealth visit, make sure they have somebody available for safety purposes. And then number 4, please use a professional, non-distracting background. Of course, we'll be using our treatment rooms, so those are pretty professional. And for them, make sure that they don't have any clutter that they might be able to trip over or injure themselves while doing the telehealth visit. Roman numeral 4, here's the big secret to performing a telehealth evaluation, guys. It's not that much different than what you do already. So subjective, you need to make sure you take a good subjective. Ask them to tell their story and then let them talk and you listen. Because this is, and you all well know, I don't have to tell you that this is where we get most of our information so that we can set up a plan of care. I didn't list the rest of the stuff for the evaluation, like objective and assessment, but you all know what is contained in the evaluation. But I did want to mention the subjective part because that's very important to us. Now, how to end the telehealth physical therapy evaluation. You know, it should take 40 to 60 minutes is what they're saying for an evaluation, okay? Not the treatment. That is encompassing the setup of the telehealth visit, your teaching of whatever you're teaching, your evaluation, and entering the evaluation into the system. You are to code as you would in clinic, but follow EPPTS policies, state rules and regulations, and your payer policies. If you are coding this as a cash pay session, always have your patient prepay as they are much less likely to cancel their appointment. Set expectations. In other words, this is going to take us 30 minutes. This is going to take us 60 minutes. This will require you making sure that you're participating in a particular exercise, etc. And then provide exercises. And those will be reviewed later on the treatment section. Ask the patient if they understand the entire process and do they have any questions. And then set their next appointment before you hang up or multiples based on plan of care. So based on your plan of care, let them know you will be doing another telehealth next time or for the next 3 visits or whatever you all decide with the patient. But make sure that those are scheduled immediately at the end of the telehealth visit. Now, for telehealth treatments only, overseeing a follow-up visit. Again, do what you do in the clinic and include the information under number 3 for tips for PTs. And that is turn off all streaming services, blah, 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 and use headphones if you need to. We don't need to because we're going to have private rooms to teach the patients and they're pretty noise reduction. Number 2, telehealth is by nature a one-on-one procedure. And we have to have it as a one-to-one procedure. But like I said, if you're going to have people helping you, make sure you mention the name and the role of the person assisting you, and also identify whoever's helping the patient. Use one-on-one care time to actually think about your patient. In other words, what exercises and I'm going to be providing for this patient, what am I going to teach them, and make sure you prepare this prior to the visit. We don't want to be teaching or thinking of exercises during the telehealth visit. Anything you do in the clinic, you can try to translate to home. So think about exercises that you, like for instance, I had a patient the other day do an e-visit sometime back. And she said, well, how am I going to do the upper cycle? How am I going to be able to assimilate that exercise? I said, get a 3-pound weight on each hand, put your arms at shoulder level, and go forward for the amount of time we tell you, and then backwards. And make sure that your back is supported and stuff like that. So that's just one example. Use an online exercise program like MedBridge. And remember, we can share our screen via Teams and can pre-populate Google or YouTube videos of exercises to assist with time. So if you know of some exercises on Google or YouTube, put those up. Start the telehealth and then tell them, I'm gonna share my screen with you, or go to this Google site and let's practice this exercise together. Certainly different ways of doing this. I'm only sharing some ideas that we've talked about with several providers that are doing this already. When you use YouTube, set up a list of your best liked exercises, or if you're not using YouTube, video your own exercises, especially those that are specialty like some for McKenzie or Mulligan that are base programs according to those programs. Exercises. Think about these things. Safety first. You have to assess the environment where the patient is going to be exercising. Make sure you do that carefully. Are we covered under our liability insurance if they hurt themselves at home? You know, I'm assuming we are, but we don't want to assume. I asked David from Texas Physical Therapy Specialist. He said he hadn't thought of that, and he's going to research that and find out and let us know. And we also, Sylvia's going to call our liability insurance and find out if we are covered for that. Since it is considered an in-clinic type in-person visit, telehealth, we should be covered, but we're going to make sure that we get that information, especially to make us all safe. Effectiveness. What do you use that is most effective? Use 2 or 3 exercises. You know, show them self-mobilization, show them posture, whatever you can think of for your plan of care. Equipment. Ask the patient, what do you have that you can use at home? Do you have dumbbells? Do you have TheraBands? Do you have sports cords? What do you have available so that we can perform these exercises? And this can all be asked at the appointment date by the front office. And then set up your own packet according to a diagnosis, or use the prepackaged exercises / supplies that Adrian from EMSI has provided to us. I think every clinic has one now. It's not all inclusive. And quite frankly, I don't like the packages that they put together, but they are helpful for some diagnoses. So you might want to review that. And then don't forget about other resources like Instagram for ideas. You know, and I've listed several that have some exercises that you can apply to your patients. Certainly it's not all inclusive also. So if you know of any better ones, go ahead. Outcomes, patient satisfaction, always need to have the patient happy, and we need to meet their unexpected needs. Don't try to recreate a clinic visit based on number of codes. In other words, don't set up a telehealth visit and say, I'm going to bill for 97530 times 2 and 97110 times 1 so I can fill in 45 minutes. Instead, give the patient exercises, review and build a program, and again, set expectations. So bill your codes after you've presented your telehealth visit. Keeping in mind, and this is a sidebar, I spoke to David again and another person in Seattle, and they are billing an average of 2 to 3 units per telehealth visit, because they don't want us to be spending all our time on telehealth, because really our skill set is for manual therapy and the other things that we do best. Treatments. This is just some ideas, but typically exercise driven, but maybe self-mobilizations, ergonomics, etc. Anything that we can teach the patient. Your approach can be eclectical. You can include McKenzie, Mulligan, Gary Gray, Gray Cook, or even your own exercises or ideas that you've had prior that have been successful in meeting the patient's needs. So that is pretty much the procedure that we're going to use for the treatments and evaluations. If you have any questions, let's get them on chat and we'll answer them at the end of this presentation.
Okay, so next we're going to continue with the physical therapist and physical therapist assistant portion. Let me share that.
Okay, just to show you some examples of what Optimus PT will look like. This first one for the visit type, when it's selected as a telehealth follow-up visit, you'll see it in the drop-down. So as you're scheduled, that's how it will appear for that patient-specific visit. Also, another thing that we just wanted to show you is similar to the e-visit, Optimus PT already has a pre-populated template for you that you can use. This is under the subcategory virtual healthcare. The only difference now is instead of it saying e-visit, you're going to change it to telehealth visit. It's a drop down also, so you just click on the drop down and then turn it into the telehealth visit. Under the third one, where it says the telehealth visit was performed using, their Teams is not actually one of the options on it, but it is a field that you can text. So because the Teams is being used, you'll type in Teams on there, and then you'll add it. Okay. And then for the next one, just some other additional information. The on-call therapist for your clinic, you'll want to make that person the first option when performing these telehealth visits, unless the PT or the PTA has specifically been requested by the patient. You do not want to replace an Optimus PT in the clinic appointment slot for a telehealth visit. So right now, the way we're having the schedules where there's the 2 patients per therapist per hour, you want to try to eliminate putting one of these telehealth visits in one of those appointment slots. Because you do want to try to keep those for your patients that are actually coming into the clinic. If a patient is being seen, and then like mentioned before, if the patient was being seen in the clinic and for the telehealth visit or like a blended service, the therapist just needs to document the reason the patient is being seen for both and why they're doing it. So an example would be due to the pandemic, the patient is being seen in the clinic due to a comorbidity they have of that's why the patient's being seen for the telehealth and vice versa. Okay, in regards to the business office section, for the business office, notification to them of the telehealth visit is done by the visit type. So selecting the telehealth follow-up, the progress report, the re-eval, the discharge that the patient is scheduled. Please ensure that the visit type is not changed to any other type. I know sometimes when you're going in there to do the documentation, you'll change it to like the evaluation or change it to one of the other ones just to bring information over. If you do so, just make sure and change it back to the telehealth follow-up because that's the only way that they're going to know that it was the telehealth and to be able to add the specific modifiers that are needed for those claims to go out. And then there's an example of what that's the screen, the billing screen that they see. So they're going to be looking for those that say the telehealth follow-up. And then just to give you some other, just a little information on how the insurances are going to be billed, we do have to specify like our place of service and our modifiers for them. So for our Texas workers' comp, our commercial insurances and our Medicaid, we are able to use place of service 11 with a modifier of a 95. And the business office, they will adjust the place of service according to each individual insurance or payer type. So if they have to use a different place of service, then they'll go ahead and they'll do that as needed. In regards to the marketing, we spoke with Margot, and for the marketing department to promote the telehealth, it's going to be done via our website, our social media platforms. The magnet card will be updated to reflect below. The e-visit was taken out of it, and we're just going to include, we just have the telehealth through your electronic device now. And then she's in the process of creating a flyer that will be distributed to our physicians to promote the telehealth as well.
By the way, I want to mention that Sylvia from the business office has blessed that procedure.
Okay, so at this point, that's the end of the presentation. We are available to take any questions that y'all might have in reference to anything that was presented today. Okay, so we have a question from Isaac is, are we allowed to schedule a telehealth visit at the same time as an in-clinic visit? Lydia?
I'm like, I can.
Yeah, are we allowed to schedule a telehealth visit at the same time as an in-clinic visit?
For
Oh,
for can you unmute him?
Yes.
Isaac. So you mean for different patients, right? Like, so if you can have a telehealth visit at the same time as a different patient is scheduled?
So I have a patient in clinic, and then I'm working with the patient on the computer at the same time.
No, it's not recommended because they're saying that for your telehealth visit that you need to stay with that patient that whole time.
Okay.
Yeah. So that's why we want to try to go towards whichever therapist is on call. Like, I know Horizon's a little bit different because there is just the two of you. But we want to try to go towards the on-call therapist so that way it prevents that from happening. Because yeah, if we do that, then that'll like lose a visit for your in-clinic.
Okay.
All right, thank you for your question. Anybody else have a question? I can unmute them or I can read it off the group chat. Okay, on the magnet card, when the patient tells me they do not have a computer, where can we write it down?
so can I answer that?
Yes, yes, Rudy?
I'm gonna jump in. Jolie, you mean where are we gonna write it down on the visit? Unmute yourself. There you go.
Yeah, we're unmuted. Yes, it's a twofold question. So they'll right away tell me so that I or someone who covers for me, we won't ever anticipate that e-visit is even possible for that person. Or can we put it either on the flow sheet somewhere or an EMR?
On the EMR, you can go ahead and place under a reason for referral. You can also put on there unavailable for telehealth visit due to no computer. However, we will complete one via phone visit and or a in-person visit.
Okay. And then should we maybe make that our last entry so we always all know where to look?
Yes, the last entry under your reason for referral.
Okay, this next one is more of an idea. As you were talking about the tips for patients as to how to prepare themselves for an e-visit, at the time that the magnet card is given, the patient tells us, yes, I'm available. Is there any way to promote the e-visit that at that time provide them with a really nice handout that says, these are some tips that we'd like you to start practicing at home so that if I need to have one, they can take that home?
I think it's an excellent idea, and we will prepare that for the clinics, Charlie. Thank you for that input. Yes, and we need to get away from saying e-visit, by the way. We need to say telehealth.
So telehealth, and then that way, you know, they can digest it when they go home, and then they can say, I was practicing it, I don't know how to do it. So that one may be a good way to, because it's at that time of the evaluation where I find out yes or no.
Yeah, excellent idea, and absolutely, we'll come up with it.
I have a question.
Yes.
When will telehealth end? Until all this is over, or?
You know, the talk around the country and with Confluent is that they expect telehealth to go beyond COVID-19. It'll be part of our physical therapy practice from now on. And since it made it into the rules, I expect it to be beyond that. Yes.
Rudy, if I can chime in October at our EPPTS conference, way before COVID, they said this is the future.
Mm-hmm.
They had already asked to start get ready because those who had direct access were already doing it.
Mm-hmm.
It's here to stay.
Yes, it is.
Okay, and then I just want to jump in here real quick because I wanted to share with Chole a couple of the items that we already have in reference to patient education. This one right here simply just goes over what they need to do in order to sign their document online. This was created by our friends at Texas Special Physical Therapy, and they shared it with us, but it is the exact consent form that they use. Excuse me, the walkthrough that they use, and this is given to the patient. It's real simple. It's step by step. It's got a nice little picture there of a computer that kind of gives it. And then we also have one for teams in case they want to use a smartphone. It gives them the full instructions with little screens on what to do. So these are kind of the instructions or handouts that we'll be having saved in our file. And this right here is going to be the instructions for the computer. So like you say, tips, but this is more of a how to get it in and if they have any questions. So I wanted to share that with you because we have something of that magnitude, but not necessarily the tips, but that's something that we have already.
Where can we find that?
We're going to be saving that in the same HV shared files that we, what is it called?
East-West HV case management forms.
Right. So they'll be all saved there.
You might want to print them out and look at them and familiarize with them so that you know what we're handing out to the patients.
Yes.
That's a good idea. And every CD should, an OC probably should look at those. Isaac put up a question.
Okay, so Isaac is asking, how aggressive does the company want to push this as an option for our patients?
Well, I can kind of chime in first and say that a telehealth visit, Isaac, should never replace an inpatient clinic visit. Not meant to do that. But certainly, we need to give them that option of evaluation, like Chola mentioned, that it is available. And especially, I tell them, if you foresee yourself, if you get sick, you can't come in, we have a televisit that we can do with you, telehealth visit, and that's an option. Or if you don't have transportation, don't call and cancel, instead set up a telehealth visit. So it's used as a way of maintaining our census, mind you, and keeping those visits, but really to make sure that we continue to provide the care that the patient needs. Is that acceptable? You're muted.
Okay, you're ready to go.
Okay. So during my evaluation, is something, do you want me to bring it up or is it something you want for me to wait for the patient to bring up?
No. You can bring it up at evaluation, absolutely. Okay. It's not like the e-visit where the patient had to initiate it.
Got it. Thank you.
Yes, sir. Good questions.
Anybody else have a question?
We have all smart people in our audience.
Is Eric there going to ask something?
No, I just asked him. He said no.
Okay.
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 Well,
If there are no more questions for this session, then we'll go ahead and end the meeting now. Thank you, everybody, for your time. I hope this was, we hope that this was very educational. We are available for any questions you might think of later. Feel free to send them and CC all of us. That way, if it's one of our specialty, we can answer you guys. But we're available to help everyone, to help this make it successful. As you're scheduling them, if you have any questions regarding the technical component, reach out. If you have any problems regarding the setup, the case management, scheduling, reach out. And if you have any questions that Rudy can help out with, reach out. Other than that, thank you very much for your afternoon. Have a great Memorial Day holiday. We will see you guys and talk to you guys again on Tuesday.
Bye.
Thank you.
Bye.